So for this video, we're going to be talking about an assessment, or I should say assessments, plural, for the distal biceps. Now, distal bicep pathology is more rare than proximal biceps pathology. That doesn't mean that it doesn't happen. And so we have 3 assessments that we can perform to assess whether or not that distal biceps tendon is still intact or if there perhaps is a rupture. So let's go ahead and get started. So for this test, you want to make sure that your patient or client is comfortable. I find using a pillow to support their arm while we're making our assessment is a nice way to ensure their comfort. The first test is a rather simple test, and it's known as the hook test. And in essence, what you're trying to do is use your index finger to hook the distal biceps tendon. So what that would look like is you're going to ask the individual to contract their biceps. Maybe you do that by providing a little bit of resistance to the distal forearm. Once you see the muscle belly or where the muscle belly should be, you're looking to allow them to relax, and then you would palpate the tendon and hook it and pull on it and see if there's any laxity or if it's taut. All right? So it's a rather simple test. In essence, you're just looking for the placement of that tendon as well as the integrity, the fact that you can actually hook it with your finger and it can resist that. Now the second test is what is known as the passive forearm pronation test. And in essence, what you're looking to do is to begin in the position that we're in right now, which is full supination. We're going to roll the shirt up here just a little bit so you have a little better visual of the biceps. But what you'll notice is as we pronate, the biceps is going to lengthen. It's going to dive, or essentially move from a more kind of distal, or excuse me, from a more proximal to distal orientation, right? So there's a distal movement of the muscle belly, right? So why is that? Well, we know that the biceps not only has a role in terms of elbow flexion, but its also secondary role is that of supination. So when it contracts, it's going to pull the forearm into a supinated position, which means you have approximation of the muscle fibers at the biceps when the forearm is moving into supination. So conversely, when the forearm moves into pronation, that approximation is lost and the fibers lengthen. So you're just looking for the visual change in the muscle belly to go from a more approximated to a lengthened position. So it's purely a visual assessment. Again, that's passive forearm pronation. Now our third and final assessment technique is what's known as the bicipital crease interval. Now what you're doing here is first you have to set up your measurements. And so what you're looking for is to assess where the antecubital space is and the crease there. You do need to have a pen handy. Once you identify that, you can make a mark. From here, you then want to find where the distal biceps curve ends. Okay? And so really all we're doing is just a visual assessment. We can palpate a little bit as well, but where that curve ends, we also make our mark. And unfortunately, my pen's not working too well here, so let's use a marker instead, just so you can visualize this a little bit better. So as we palpate down, here's the point of our distal biceps, and here is our antecubital crease. Now for this, we have our 2 marks here, right? Now, the measurement is going to be taken from where this curve and crease is to then the antecubital crease. This is not an active assessment, meaning you're not asking the individual to contract the muscle, because what's going to happen is that's going to distort where you place that mark for the curve or the crease of the distal biceps. So it's just a static measurement. Now, if that measurement is greater than 6 centimeters, okay, so stop and think about that for a second. Just visually, you should be able to kind of do this. 2.54 centimeters is an inch. So really, if you're looking at this, if that interval is more than 2.5 inches approximately, that leads you down the path that there could be disruption of that biceps, which means that it is approximating and it's moving more proximal. Additionally, part of your assessment is also to compare the uninvolved side to the involved side, the side that you're assessing. And so you can also calculate what's known as the biceps crease interval ratio, which in essence is you would take your measurement on the left side, our involved side, you would compare that to our uninvolved side, the right side, and when you take the injured side divided by the uninvolved or uninjured side, if that ratio is greater than 1.2, then there is a higher likelihood that they do have a distal biceps rupture. So, 3 assessment techniques here for you to work through as you consider a potential distal biceps involvement. Have a go with a peer or colleague and let me know if there's any questions.